I want to thank George for that nice introduction and thank George and David for their great leadership at the Roundtable. I also want to thank Dan for his overview presentation. And point of privilege, I also want to thank Joe for hosting the meeting here today. And I say that because we are in East Harlem, and I grew up in East Harlem. And I took the cab ride in across 106th Street, saw the two projects where I grew up, saw my father's church, still there, different name, but the church still stands. Saw the East Harlem Protestant Parish reading tutorial program that my mother started, which is building a huge new building in El Barrio, and it's, again, a point of personal privilege to be here in this neighborhood again. So thank you, Joe. So we're going to move on to more of a conversation now of business engagement in population health improvement. And sort of just to set a little context, one of the dominant themes coming out of the roundtable discussion is this notion of multi-sector and multi-stakeholder engagement. The issue of the fact that we rank 37th in health status in the world is not something where you point to public health and the healthcare community and say, go fix it. That is not the answer. A theme that's come out of the roundtable discussion is that this is very much a team sport, has to necessarily engage all stakeholders. And if we really dig a little deeper, and understand both the motivation and the influence that other sectors have on the issues of population health improvement, particularly the social determinants of health that are so dominant in influencing health status, then it comes as no surprise that we would focus there. So it's great that today we're going to dig deeper in terms of one of those stakeholder groups, and that is the business community. That, again, I would argue has both a self-interest and a tremendous influence, potentially, on improving population health. And so, we're hoping that this conversation, of course, gives us insights in terms of the role of the business community, but I think it can also inform our conversation about how to engage other stakeholders in this conversation as well. So while we're focusing on the business community, I think it has some application for how do we get transportation and education and land use and economic and job development communities more involved in these issues explicitly. So we're going to start the conversation, and as we should appropriately, and the title of our session is The Case for Business Engagement in Population Health. And as someone that has worked half of my career with the business community, my take home here is it ain't easy, folks, and it's nuanced, and there's not a homogeneous business community out there when it comes to these issues of health, population health, and healthcare. And sort of a takeaway lesson for me, informed by my interaction with the business community, is that often it has more to do with business culture in terms of engagement than whether there's a logic or whether there's, a clear business strategy for engagement. I mean, we could sit here and talk about 100 different reasons why logically the business community should be more engaged in these issues, and I'm sure we'll get into that. But at the end of the day, often it's culture. And this was driven home to me in a conversation that I had with the CEO about 10 years ago, where I went through my impassioned plea for his engagement in health and healthcare issues. And did my 10-minute and made all the arguments, health and productivity is key to your business success. You can lower your business, all of that good stuff that we all talk about. And at the end of the 10 minutes, he turned to me and said, Andy, you don't understand. I get up every day as a business leader trying to stay competitive in a global economy. And frankly, I don't think about these issues of health and healthcare. I'm thinking about how to make my product more competitive in a very competitive and global economy. And that was sobering for me, because again, while the logic might be there, these issues of business culture, I think, are so dominant, and I hope we can get to those issues today. The second issue is, for me, or takeaway, is while there's been significant progress in the business community in getting them motivated to take care of their defined population, their workforce, and for the last 20 years, we've seen an explosion of worksite health promotion and wellness programs, and the business community trying to build communities of health within their four corners. But as already been mentioned today, it is much harder to make the leap and get business engagement at the community at large. And as we've already talked about this morning, it's that larger community with those environmental attributes that can influence tremendously the health and therefore the productivity of businesses' workforce. So we're going to talk a little bit today. We're not going to talk about worksite health promotion. We're going to talk about that leap and what it's going to take to get business leadership and business organizations more involved in this team sport that we call population health improvement at a community level, and what it's going to take. And starting that conversation, we're going to talk about what is the case. And the case in multi-dimensionals, not just the economic case, but other factors that might create a reason why the business community should be engaged. So that's my little tee-up of the issue. And now I'm very pleased to present our panel. And the panel will each have 10 minutes to present. They'll have a little button here that shows them that the time is up. Probably the beeper goes off and Colin will jump up here with the hook if you're not done. But we're staying on time. So we have, as we always do at these roundtables, which is so great and so rich, a conversation with you at the end of the presentations. So I'm going to make the first introduction. Michael O'Donnell is the Director of Health Management Research Center of the University of Michigan. He's been a long expert in this whole arena and a great colleague and friend over the years. Again, there's a lot more on his bio, but Michael, you're up first. Thank you.
Thank you very much, Andy.